I'm Dr. J.D. Fiechtner. I'm a key account veterinarian for Beringer Ingelheim Animal Health and work with swine customers in the United States. The main vaccine that I'll talk about today is a modified live vaccine made for PRRS, which is a serious swine disease. PRRS being the disease entity we're talking about, PRRS is an intracellular virus. It lives inside the macrophages in the body and replicates. And the humoral immunity that comes from killed vaccines is not very good at protecting or going after intracellular viruses, whereas the cell-mediated immunity does go after intracellular pathogens. And so that's the difference on the PRRS, is you want something that's two-pronged, both the humoral response and the cell-mediated response versus just one. Vaccine was initially released in like 1994, the mid-90s, to help be a tool in the toolbox to help control the detrimental effects of that serious disease. And so modified live vaccines have been around in the animal industry for decades, and the difference between modified live vaccines and what people are more used to seeing on killed vaccines is that a modified live vaccine is changed or attenuated so that it does not cause the disease, but it will still replicate and reproduce in the animal's body, so it mimics a true disease and stimulates the immune system to react and respond accordingly without actually causing the disease. Whereas killed vaccines are, the pathogen is grown and then it is killed and then preserve the antigen or protein pieces, and those are injected to stimulate a humoral immune response from the animal. So the main difference between the two is the killed vaccines will promote a humoral response where the body makes antibodies against the antigen. Modified live, where it actually grows and replicates in the body, will stimulate antibody in the humoral response, but it will also stimulate cell-mediated immunity, which is important for a quick response and some antiviral components of an infection. Modified live vaccines, since they replicate, they're usually a smaller dose, and they usually require no or very small amounts of adjuvant, so they're usually a little bit less reactive, a little bit safer in allergic reactions than killed vaccines are, which have higher antigen amounts and or more aggressive antigens. So pro is that the modified live are a little bit smoother, a little bit safer. It stimulates that cell-mediated immune response, which is important, and it also, by replicating in the body, mimics a true disease component. The negative side of modified live vaccine is you have to be a little bit more careful in how you handle it, how you store it, how you mix it and administer it within a certain time frame. It's a little bit more sensitive to some environmental components. So there's some differences between the two. You have to know, or I'd say discuss with your veterinarian or health professional what your disease concerns are and what vaccine works best to try and accomplish your goals.